Welcome to We Are North Texas, a podcast brought to you by the University of North Texas system that focuses on innovation, compassion, ideas, and accomplishments in our home region of Dallas-Fort Worth. The UNT system is the only university system based in DFW and includes the University of North Texas, UNT Health Science Center, and UNT Dallas. With our heart in North Texas, we transform lives and create economic opportunity through education. Welcome back. I'm Paul Corliss, Chief Communications Officer for the University of North Texas System, here with co-host Rudy Bush of the Dallas Morning News. And we'd like to welcome two very special guests to the podcast. They've been leading the fight against COVID-19 in Dallas County for more than a year now. We're going to keep our city and surrounding communities informed and safe. Clay Jenkins, Dallas County Judge, and Dr. Philip Huang, Director and Health Authority for Dallas County. And I'll start with Judge Jenkins. Judge, we're more than a year into this thing. We talked to you on our other podcast over the summer, and I'm guessing kind of feels like you're living in the movie Groundhog Day to a degree, living the same day over and over. But obviously we're making progress. And I guess the question is, have we turned the corner, and when can we expect to get back to normal, whatever normal is?
We have turned the corner. Things are looking better. We are winning this fight against COVID. And the more people get vaccinated, the better it's going to get. I think we're going to reach a form of herd immunity in the early summer. So that is where enough people are vaccinated, along with enough people who still have antibodies from being sick, to where 70 to 80% of our population has some immunity. And that may be a first shot immunity. And then as we get more shots into people, we're going to be reaching the sort of herd immunity that Dr. Fauci is talking about, where 80% of our people are fully vaccinated. Now, to do that, we're going to have to ramp up vaccination. We're going to have to get more shots and then increase more throughput. And then finally, we're going to have to overcome vaccine hesitancy so more people sign up for the shot. But if we all work together, the world's going to look a lot different and a lot better by the end of the summer.
Yeah, I actually got my second shot over at Fair Park yesterday. Dr. Huang, anything to add to, kind of how are we on the pathway back to normal?
No, I totally agree with what the judge was saying. We are making great progress, but we're not there yet. And so just, reminder, don't relax on some of the, still the masking and when outside in crowds, still avoiding crowds. Washing hands, things like that are still important. We've got some of the variants that are circulating in our community. So we've definitely turned a corner, but we're not out of the woods yet.
Well, thanks guys for being with us, because it's so important. I want to actually wind the clock back. We're a year and a little bit here into what is essentially an unprecedented American isolation and public health response to a disease. I'm just wondering about your experience in those first weeks of March 2020, late February 2020. Dr. Huang, when did you realize this was going to be the kind of global pandemic that we've been warned about could come? How did that understanding come to you, and what was your advice at that time?
I think we were following earlier, what was going on in China, and obviously very concerned about that, and it was sort of the scenario had most worried about, and we have always known it can happen, and I think that we were definitely following the global events very seriously, and recognizing that this could be very disruptive locally. And I know when we got our first case, then in March, recognized and with the judge's leadership, that we really needed to respond quickly and not delay.
Judge, obviously there was going to be a public health response here, but there was a huge political element to this that is ongoing. It's been part of the response ever since. What was your thinking in those early days of the pandemic of how am I going to balance the public health message with the inevitable politics? And did you have any idea at that period of time what the challenges were going to be along both of those areas?
Well, early on, and I've done this with Ebola and West Nile virus as well, when it comes to a public health emergency, it is going to respond to taking the cues and the advice of the people who have trained their adult lives for this moment. That is the scientists and the doctors who are experts in that field. And so with West Nile virus, we listen to the mosquito experts, and with Ebola, we listen to those experts, and with this, we're listening to those experts. And so politics never really came into play as far as deciding on policy. But politics did come into play on how we message policy and how we build consensus around policy. And so I knew communication would be important, and just as it was in other emergencies. As I made these decisions, I sought the input of all the mayors and all the city managers who have a part of their town in Dallas County. And so, we did that. Our first decision was to limit crowd size, and we sought everyone's input. Our second decision was to stop people from eating in restaurants, but still having takeout, and patio, and delivery. And sought everyone's input on that. I can't say everyone agreed to all the decisions. And even when I did this safer at home order, I sought all their input ahead of time, and always told them ahead of time, at least an hour or two ahead of time. After hearing from them, I would get back with them and tell them what my decision was, so no one felt left out within the municipalities here. And then after that, working with the county judges in the surrounding counties to get them to, make the same decisions that our doctors were recommending that we make here. And that worked well. But then, as you know, politics did get out of control because of, and leadership really matters. The president of the United States chose to make this a political thing. And that was something I hadn't dealt with before. That didn't happen with Barack Obama and Rick Perry in the other emergencies. So it's different.
Well, and I think that's been the toughest thing for private citizens like us is you're not always sure who to listen to, right? You're getting one message out of Austin and you're getting another message out of Dallas County. And you mentioned communication. Certainly you've been accessible and I follow your tweets on a day-to-day basis to know what's going on here, but it has to be a unique thing to have that conflict. And how did for us, it's like, who do we listen to, right? That's got to be a unique challenge.
Well, it is, but it's really, it's a simple thing. If you want to know what you can get away with and what is legal, then you look at the governor's executive orders. For instance, you can go if you want to and dance till 2 a.m. close to someone else in a bar. That is something you can get away with. If you want to know what the doctors say is safe, then listen to Dr. Huang and the Public Health Committee and my tweets, because I'm not coming up with, as a layperson, what I think is safe. I am listening to what the doctors tell me is safe, and I'm getting that information out to you. And it's important to remember also for your listeners, these aren't my doctor buddies, okay? Most of these doctors are people that I did not know before this outbreak. My doctor buddies, Dr. Fauci, is a friend, and some others, but that's because of Ebola. And I've got a lot of friends who are vector control doctors for the CDC, but I didn't know these doctors before this started. The way these doctors were chosen is by the position that they held. The head of infectious disease for the Baylor Hospital System, the head of infectious disease for the UT Southwestern Hospital System, the CEO of Parkland, the president of the Dallas County Medical Society, etc. So they were put on a committee by me, but they were put on the committee based on what positions they held not based on a past affinity with me. And so it is truly a committee of experts, not a committee of people who I've appointed to jobs, who owe their salary to me, who I can fire. So people should feel comfortable listening to that. They could be wrong, but it's just like if you had cancer. If you had cancer, you wouldn't tell the oncologist, listen, dude, you don't know what you're talking about. I read something on Wikipedia about rubbing avocado on myself, and that's how I'm going to cure cancer. Or you wouldn't say, you know, I tell you what, I'll go to one radiology appointment, just one, but I'm not going to the rest of them. You know, we're not doing this, we're not doing that. If you want to be safe, you're going to follow your doctor's advice. These are your doctors in keeping safe. And what they're telling you now, the most important thing that they're telling you now is register in as many places as you're willing to drive and get vaccinated. And if you've already gotten vaccinated, tell your friends to get vaccinated. Show them that you didn't grow that third year and that you got more freedom, and get them to do the same thing. We're going to beat this thing.
Avocados or a sip of bleach, maybe, whichever one you've got handy.
Bleach.
Yeah. Don't do that if you're listening to this. So, Dr. Huang, I want to start with you and then go back to Judge Jenkins, because obviously the nation has suffered more than 500,000 deaths of COVID-19. We've had a great deal of suffering here in Dallas County as well. If you had a time machine and you could turn back the clock, is there anything you would do differently?
Well, I think that as the judge mentioned, and as we alluded to earlier, we were the first county in the state to issue the stay home, stay safe orders. Unfortunately, at the state level, and the governor, really then restricted the local ability to do more control. And that's where, as the judge mentioned, and I always appreciated his, he has been steadfast in saying, stick with the science, listen to the experts. We've always had to go because of the usurping of the power of the ability to, change policy at the local level. I had to always say, just because you can doesn't mean you should. And so our group, came up with the guidance and recommendations from our local experts, but we didn't have the ability to do local policy to sort of enforce some of those things. So, I mean, I don't know that there's anything I would change. I wish that there were things that were changed during the course of this that had, given us a little more authority to do some things.
Fair enough. Judge, anything you wish you could take back or change, shift?
Yeah, I wish we had known about the efficacy of masks early on. I think that would have made a big impact. Had we known that, that would have been something that I would have asked people to do, on the first day. But we didn't know. I think whenever you follow science in a public health emergency, it serves you well. And when you see politicians either not follow science or try to kind of split the baby between science and political interest groups, in this case, the Tea Party here in Texas and nationally, it's not going to serve you well, right? Because the virus is a relentless virus looking for another host. It doesn't care whether you're liberal, conservative, moderate, black, white, Democrat, Republican, old or young. It's just looking for another host. And so when we don't follow science, we fail. And we saw that in Texas. We did the safer at home order. Then the surrounding counties did it the next day. Then the governor did it the next, I think, 2 weeks later. And we saw the numbers going down. Then he said, let's quote unquote open up Texas. Everybody started packing back into bars. The numbers shot back up. Same thing happened again after we got the numbers back in control in September and October. And it's not because one political party is doing a better job than the other political party. It's because the underlying science and the doctors are advising. And when we take that advice, and in this case, it has been one political party that's consistently pushed to follow that advice, but it's been following the advice. And it hasn't always been like this. In Ebola and West Nile virus, Rick Perry was right there alongside me, following the science every step of the way. And you saw those get under control quickly. And in other countries that have had a much better outcome in course with COVID, you haven't seen this sort of disconnect from the political leaders. There are still people in those countries who are shouting, as they did during the flu epidemic of 1918, that their freedoms have been abridged because they can't, do certain things. But when the leadership at the federal, state, and local level is following science, a lot less people die and economies are a lot stronger.
Let me play devil's advocate on this a little bit, though, or at least try to represent what I hear from, I guess, the other side of this argument. And I am sure that as we get further along in understanding what happened in the pandemic, we're going to learn a lot about the impact of isolation, of depression, of economic impact on small businesses. And my sense from the other side of this was, hey, there is the infection problem that we have to deal with, but there is another human concern here that we have to balance as well. So how can you talk a little bit about whether you felt like you got the balance right on that, and whether there was any validity to that perspective?
So there is validity to the perspective that, mental health is extremely important. Isolation has been tough. It's been tough across all sectors. It's been tough for our kids who really need that social connection and are, learning. A lot of them are learning from home. It's tough for our every older groups and everybody in between. It is a false choice, though, to say we have to balance between public health and mental health. Public health and mental health go hand in hand, right? So it's not whether or not we wear masks that determine whether or not people have mental health. When you look at the economy, and I'm speaking as a person who owns businesses as well as the county judge, for people to utilize your business, they have to believe they're going to have a good customer experience. They're not going to spend their money with you. They're not going to buy your newspaper if they don't think it's going to be a worthwhile experience. If they think that your business poses a threat to their safety, unless your business is, an amusement park and they're looking for a thrill ride, they're not using your business. So by messaging what is safe, by encouraging businesses, as we did early on, working with businesses and with their associations to come up with safety protocols so that the employees could feel safe and the customers could feel safe. Remember when we were at Safer at Home, with the exception of restaurants, most businesses were open with safety protocols in place. So and restaurants were open for delivery and patio dining. So getting those things right is the best way to build a strong economy. When you have a situation where people don't feel it's safe, then they don't utilize that business. So I don't think you can really lay it at local leaders or Dr. Fauci or anyone feet that people are uncomfortable going into businesses. That probably has more to do with the facts on the ground that thousands of people have died here in North Texas and 500,000, in our country.
As you answered that question, Judge, one of the things you mentioned was kids as it relates to isolation. And I wanted to ask Dr. Huang about our kids in schools. Right now, the vaccine has generally gone to older populations, obviously. I have a 17-year-old, and we're just going to be able to get her to be signed up to get vaccinated. And she's in high school. In her high school, I was just talking with Rudy about this. They held a dance, and over 40 positive cases have come out of the school now. And I think we're seeing maybe a false sense of security from mom and dad that maybe got vaccinated and these kids still aren't. How do we deal with that side of things, Dr. Huang, as far as, understanding that even if mom and dad are vaccinated, there's still a risk here for the kids? And when do we see that changing for the young people in our population?
Well, again, I think it is part of that same messaging that we're not out of the woods yet. We still need to be doing the prevention efforts and trying to slow the spread. And we've been working with the schools and the superintendents from the start. And it's, actually the schools themselves have been doing pretty good for those that were in classes. They were doing pretty well with the infection control and controlling it, but it was these outside events.
Right.
It was this athletic events. It was the other social events surrounding these things where the transmission is really occurring. So, I think that continued education, that education that we do need to continue to be concerned about this, and that just because the vaccine's out there for the adults, that it's not over for these youth.
So
because actually some of the latest data we just had for the last week, and we've been making great progress with the vaccination and with the decreasing numbers and indicators, although we did see some disturbing trends with increases in some of the youth numbers.
Well, that was going to be my next question, was about the vaccination program. Do you have estimates on what, the percentage of folks in Dallas County? What's our percentage of people that have been vaccinated?
So as of Tuesday, it was about 26% of all people had at least one dose. And then, and this is actually 26% of those 16 and older, and about 13% had received the full course, either the 2 doses of Pfizer or Moderna or a single Johnson & Johnson. So about 13% again of 16 and olders. But that changes every day. We're
Sure.
we're getting a lot of people vaccinated every day, but that was, I think, numbers as of Tuesday.
Every day feels like another step up the mountain, which is nice. I want to get into this question of vaccine hesitancy, and also the really concerning element that came out at the beginning of this and that we've seen continue throughout, which is the lower uptake among minority residents. And do we have any clearer sense now of what some of the root causes might be of that and how that can best be addressed? Are we making progress in that area?
There's been certainly some research and information about that, particularly with the African American community, some of the distrust based on historical, really horrific things that occurred with the Tuskegee, syphilis studies. There's in the Hispanic community some general distrust of government. Those have been a lot of the concerns, questions that we've had, even that, when we're collecting information for the vaccine monitoring or not, this is, available for undocumented persons also, some of those type of concerns, a lot of, again, with the distrust of the government, that this was a rushed process, that it didn't go through all the testing that normally occurs. But fortunately, we've had many community leaders, many people from the community, church leaders, others that have been, setting the example and expressing the support for this, rolling up their sleeves, showing that they're getting the vaccine. And we're trying to further work with community partners and others to dispel those, to get the education, to get the information out, and answer the questions that people have about it and concerns.
And Judge, I know that it seemed like from the outside looking in that there was a great deal of effort to try to make sure that this was equitable from the get-go, and especially in terms of the placement of the vaccine sort of distribution center at Fair Park, but it just didn't work out quite like you expected, it seems. And so take us back to that decision and what you feel was done to try to make sure it was equitable, and what you might do differently or would have done differently if you could do it all over again.
Sure. And before I do that, That's the great thing about the federal partnership and it being able to focus on census tracts below 150% of poverty, is we got a whole lot of people, diverse people vaccinated, and then they become ambassadors to their friends and their neighborhoods. And so our numbers have greatly improved on diversity with that federal partnership. Now, going back to what happened in the beginning, we had a system that a computer system that we have had to switch out of. And in that, we no longer have that vendor. In that system, it allowed you to forward the link that you got to people, and it allowed that link, if it was posted on Nextdoor or Facebook, to be accessed by people. And so people in wealthy neighborhoods who were predominantly Anglo, 75225, 75205, 75229, and 75230, and also 75248, got that. There were members of the city council who posted it onto their newsletters, and that went through, and those residents took up all the appointments that had been sent out to people based on the Parkland Center for Clinical Innovation vulnerability scale. So based on how much COVID's in your neighborhood, whether you're, older, et cetera. And so that we were able to find out that happened, stop those appointments, because a lot of the people that were coming in were in their 20s and 30s, not under 65. Many of them, if not most of them, were trying to tell us that they were like FBI agents or police officers that were off duty, or some reason why.
Oh, really? And I hadn't heard that. That's interesting.
There were 1As. There were first responders type thing. It took probably the better part of Monday to figure out that there was something wrong. One of the people who told me he's an FBI agent, as luck would have it, my nephew is an FBI agent. And so
You gotta be kidding.
I said, come on to the front of the line. We're way have a whole lot more people than we thought we'd have today. And I'll get you to help me. You just show me your credential. And he said, well, I don't have my credential with me. And I thought that was really odd, because you're required to carry your credential.
And your gun, right? If you're in the FBI. Right.
And he didn't have any of that stuff. And we started asking people what zip code they were from, and they would tell us these zip codes that we, thought were odd, that there were so many people from those zip codes that were somehow vulnerable and that they were that young. So we tried to fix that, but each time we would try to fix it, there would be kind of new ways for people to work around the system. And this still continued, even when we're doing the drive-through. People would get the QR code and share it with their friends. We've just been able to really nip that in the bud over the last 3 weeks. People are scared. They're relentless on wanting to get a vaccine, and many people don't want to wait, right? They're kind of feel like it's every person for themselves. So it's been a challenge, but it's getting better. And now if we can we're going to move, guys, to where our problem is not getting the precious amount of vaccine that we have to the most vulnerable people who have the worst outcomes if they get COVID. It's going to be hopefully very soon a throughput issue. We can only get out X number at each of these sites, and we got to build more sites. We got to find more partners, because we got so much vaccine. This hasn't happened yet, but maybe next week or the week after. We got so much vaccine that our issue is throughput. And then we're going to get, once our issue becomes throughput, in short order, we're going to get that 17-year-old child and all of those other folks that want a vaccine, and then we're moving to hesitancy. And part of that's going to be messaging from the community. But part of that, I'm calling on you got YouTube people and everyone who has had a vaccine, become an ambassador for the vaccine. I was there yesterday when Candace Sweat, your partner at NBC5, got her vaccine, and then went live to tell people about that.
Yeah, let me be clear. I'm 45, white guy with no underlying health conditions. I'm also not an FBI agent, and I've not had a vaccine.
Well, come Monday, you need to be signed up.
I'm signed up. I want to be the last in line. If everybody else go first. I'm not going and making some pretense or something, right? It's got to slow down. I'll be fine.
Well, I was there. I was at Fair Park this week and did get vaccinated, and there's a lot of people there. I mean, you guys are pushing through tons and tons of cars, and I wonder, as we talk about getting to the normal, one of the normals for Dallas and for our state is Texas State Fair, right? October is not that far away. When are we going to stop using Fair Park for this purpose and move back to normal? And then where will we be doing vaccines when we move away from that? I'm just curious how that transition works. Have you talked about that? Is there light at the end of the tunnel, plans ahead?
So I think there is light at the end of the tunnel. My guess would be that when the fall rolls around, our kids are back in school in a classroom. There may be some differences, some spacing differences, but school's going to look a lot more like 2018 than it did, or 19 than it did like 2020. And then I think the fair is going to happen. It may be a little different, maybe some spacing or a couple of rides that aren't open or whatever. But I think you're going to see the fair happen. You're right. We have a lot of people going through there. We need a lot of volunteers. So 2 kind of pieces of news your podcast listeners can use. We are encouraging anyone to go to volley.org and sign up as a volunteer. If you work a day at Fair Park, helping your fellow resident, and by the way, it's one of the best things that you can do to see the smile on those faces when they're getting their shot and to help our community get through this terrible time, you're going to get a shot at the end of that day. We're going to vaccinate you as part of the 1A vaccination team. You're going to be a part of history, a part of helping your community. Here's another piece of news you need to know. If you're Rudy Bush, if you're 45 and healthy, right, you want to sign up in a lot of places because, for instance, in Dallas County, we work on the Parkland Center for Clinical Innovation vulnerability scale. So Rudy's not going to be very high on that. But had Rudy signed up in Collin County, I don't know if he did or not, but if Rudy signs up in Collin County or Denton County, then as his name gets to the top of the list, he is locked in the moment he signs up. If an 80-year-old with diabetes signs up a minute after him, he's ahead of him. So the sooner you sign up in as many places as you're willing to drive, the faster you're going to get your vaccine.
All right. And that's good advice because I just signed up for Dallas County because I live in Dallas County. I don't want to jump the line of someone who's more vulnerable than me, but you're saying get out there, put your name on as many lists as you can, and don't feel bad about getting your vaccine.
Absolutely, because everybody's vaccine helps all of us. We're trying to get to herd immunity, right? So every person who gets vaccinated, and as they get up to that 95% protection from COVID after their second vaccine, then they are out of the vector that can lead to a mutation in this vaccine that puts us back a year. So we've got these different variants. We got the UK variant, the New York variant, and now the South African variant here. Luckily, all of these variants the vaccines are extremely effective against these variants. But even with the South African variant, you've seen a slight drop in the efficacy of the vaccine. So we've got to get to herd immunity and stop this vaccine from spreading, because how it mutates is it finds a host, usually a weak host, like someone who is really struggling with the disease, maybe has COPD or whatever. and there's a mutation that occurs there. And just like the flu, where you have to get a different vaccine every year, when you get a strong mutation going, you can jump out of the protection of this. And that's probably more of a Phil answer, but you can jump out of the protection of this particular set of vaccines. So we really are in a race against time, and every person getting vaccinated helps us win that race.
Well, here's a clarification as we're starting to wind down our conversation here. Dr. Huang, the judge has several times used the term herd immunity, and we hear it all the time. We read about it, and I don't think everybody knows what that means. Could you give us sort of your best effort at a layperson's definition of herd immunity so we understand what that means?
Sure. When you get to a certain threshold, a percentage of persons in the community who are protected, and we're talking a lot about people getting vaccinated, but then there is also some protection from people who've already had the infection. We know that at least 90 days sort of they're protected for that period. But it combined, that then when it's enough people have that protection, then it slows down the spread in a community. And so, it's estimated if we can get up to 75, 80% of the population with that protection, then that would really be the level that would slow down, essentially this spread of COVID in Dallas County. So that's why it's so important for getting everyone vaccinated, and that's what we're trying to achieve.
Well, we really appreciate you all being with us. My last question, really for the judge and for Dr. Huang, is a year ago when we started to realize that we were going to go through this to now, did this realize your worst fears? Did this have a better outcome than you expected us to have, or somewhere in the middle? And I guess I'll start with Dr. Huang and then get the judge's take, and we'll say goodbye.
Well, the level of hospitalizations and severe illness and deaths that we've seen is certainly, we're all saddened by that. And it's not, just the deaths also. There are people who have, longer term sort of repercussions and sequelae from the illness. All of that, to the extent that, we got to the level that we have and weren't able to prevent that, is unfortunate. But I think that the way the course of this has progressed, there are, and I think it's at multiple levels of response, all the way from the federal down, that have impacted our abilities and the results that we've seen. There are some countries that have had a better outcome than we've had. So, but I think given the circumstances, given the realities of what we have to deal with here, I think we've managed as well as we can. We've had to be nimble. We've had to respond to all the various things that have changed. But I think that because of all the various variables at all levels that we've had to deal with, perhaps we could have had some better outcomes.
Judge, what do you make of it?
I try to live in gratitude, and so when I look at this, in a way, it is ending the way that I expected it to. Doesn't mean I'm not grateful for it, but I expected North Texas to come together and to help one another. I expected the media to get out accurate information in a fair and balanced way and help keep their community safe. I expected public health and doctors to lead the charge. And that happened, and I think, you guys and the media have been heroic in this. The common person out there on the street's been heroic. Clearly Dr. Huang and the health doctors who led this fight have been heroic. No way to predict at the beginning or even accurately predict now what exactly the future holds. But and this lasted a heck of a lot longer than I would have thought in the beginning. But I'm just so proud of North Texas and the way that they've responded.
Well, we know this is certainly still consuming your time, so thanks for carving out a little bit for us and for
Absolutely.
our listeners. Judge Clay Jenkins, Dr. Philip Huang, thank you for joining us today on the podcast.
Thank you.
Thank you.
Thank you.
And to our listeners, thanks for tuning in. I'm Paul Corliss for Rudy Bush. We'll talk to you soon. UNT World is a special place filled with talented and dedicated students, faculty, and staff that do amazing things every day. With our heart in North Texas, we transform lives and create economic opportunity through education. We are North Texas. I'm Paul Corliss. Talk to you soon.